Okay, so Brittany, Micah, Johanna, after reviewing the case study, what kind of suggestions do you recommend as treatment options for this patient?
Surgery versus observation.
Okay. Would you, which one would you consider, surgery or?
Surgery because the curve is already above 85 degrees.
Okay, good. And for these patients, do you want to do surgery as soon as possible, or do you want to watch and wait and see if it progresses? For example, if her curve was 50 degrees, would you watch and wait, or would you go ahead and get it done since you know it's going to progress anyways?
I think I'd go ahead and do it.
Yes. Because patients with this condition, they tend to deteriorate with time, so you want to make sure you know, since you know that their curve is going to progress anyways, might as well do it now when they're healthy. Their lungs are still good, so good, yes. Now, to prepare them for surgery, what kind of recommendations would you make? What kind of referrals, labs?
We would need to do some referrals to cardiology to assess the conditions, make sure they don't have any heart conditions or dilated cardiomyopathy. They would need to see a pulmonologist to make sure they have good lungs, respiratory, not have any respiratory issues. If they possibly have sleep apnea, they would need to see an ENT. And then we would also need to do labs to make sure do their check their nutrition, CBC, and CMP.
Okay. And if their nutrition labs, if they're abnormal, say they're really thin, and how would you
Do a dietary consult.
Okay.
And start some kind of nutrition protocol.
Okay. Yes, most of these kids, if they're too thin to undergo major surgery, and if they're unable to gain their weight with just a normal, through the following the dietary recommendations, they may consider a G-tube.
That would help.
What about any OT, PT needs for the patient?
Yes, for equipment evaluations.
Okay.
Wheelchairs, lifts, etc.
Okay. Now, what about any anesthesia concerns for this patient? What would you be concerned about?
Their airway could be a difficult one. You're going to want to do the precautions for hypothermia.
Good, yes.
Keep their body temperature regulated, which anesthesia will help with. Blood loss preparation. It's a big surgery, so have blood ready in case. And an ICU available.
Good job, yes, I agree. Any other suggestions for caring for patients like these?
Just make sure that they're well consulted prior to their
They get proper
admission.
clearance from everybody else. I agree. And also, don't forget, they also need a dental referral and make sure that they're cleared from that standpoint to prevent any late infections. And you just want to teach the families what to look for, late infection, signs, symptoms, and to let us know if anything, worrisome shows up after surgery. Thank you, ladies.
Thank you.